Do you mind sharing a little bit about a craniosacral story, this book that you have for children and like craniosacral and how it fits into your child patient?
So what I noticed with the and this is with everything, whether you're going to take them for, even like a surgery, if you're taking your child for a surgery, it should still be kind of explained to them, even if you don't think that it should be explained to them, because they do kind of understand. And then the example I give for that is like, let's say you're like, the baby thinks they're going to a park and they're going to get their like lip tie snipped. I'm like, what does that do for the baby? The baby's like almost maybe a little lack of trust. Like, oh, I thought mom was taking this fun thing, and now I'm getting my tongue snipped. And I'm not saying anything bad about it. I'm just saying, just tell the child this is what's happening. Mommy wants to try to do the best for you. And so this is what we're going to do so that you can have a better life or whatever it is. However they choose to explain them, because the thing is the babies do understand and the babies do know. They're wicked intelligent. What this book does, which is so funny because I had all of them here with me, and now like my baby was a little bit like, so I'm like, okay, just go in the room and talk. Yeah, that's literally what happened. So she's out there with my brother doing something. But, like, the beauty of explaining what's gonna happen is not only, like, will mom understand, but baby will understand a little bit better, and actually, like, it'll, the expect like, there will be better healing because they're already kinda knowing what to expect. So the beauty of all my stories is that like a craniosacral story, a chiropractic story, is that, we're kind of telling our child what's about to happen. You're going to go in, you're going to sit on a table, the doctor's going to put her hands and feel the muscles of your neck. It's going to feel kind of good. But, and so it's like, I've had parents read my story, understand more what craniosacral was about, like not even for their kid, but they were just like, now I understand what you're
Mhm,
doing when you're
mhm.
putting your hands on my kid. And that's a big thing because parents want to know what's going on. And when they don't know what's going on, it just looks like we're loving on your kid, like we're holding them, we're talking to them, we're telling them how great they are, because affirmations are huge. Like that's what they should live by. They're like affirmations, feelings, beings. So you kind of want to tell, oh, you're so smart, you got this. You're so sick, and like, and that's the thing with like when parents take their kid to the doctor too much. It's like now put your body in the body of that kid. Always go to the doctor. Always something wrong with him. That's the affirmation. There's something wrong with me. I'm not enough. Why am I here? All that cascade of bad affirmation. Then where your mind goes, your body becomes. So now all of a sudden their little bodies may be getting sicker because they got the mentality of something's wrong with me. And so affirmations are huge. In my books, I talk about the inner physician, which is your almost the personified version of an innate intelligence, which is your body has the ability to heal itself. And so we're able to talk to these entities like our nervous system, our heart, and figure out what's going on that deep level. So I don't know if I answered the question or if I did, but like parents and children, when they read the book, they do understand more about craniosacral, and it becomes more healing because they know. I had a child who like the first visit was like a little bit chaotic. And then after that, the parent read she got next time she got on my table, she was like she just did it, and it was really like from session 1 to session 2, a completely different, like, everything about the session.